So today I want to share with you some insights about clinical experiences. We get a lot of questions from students about clinical experiences in terms of what counts, what doesn't count, what looks better, how to get them, etc. So I just want to dig a little bit into some insights, some details based on our experiences working with students. So I've got even a little presentation put together for you all today. Okay. So let's dive in how to get some clinical experiences, how to make sure that you can use your experiences to your advantage to be a very, very strong part of your application. So who is this for? Who needs clinical experiences? If you want to go to medical school, you need clinical experiences. If you want to go to DO school, you need clinical experiences. If you want to go to nursing school or PT school, or basically any other education in the medical field, you need clinical experiences to some capacity. So when I say the word clinical experience, what does that make you feel? What emotions does that bring up for you? For a lot of people, they have a lot of anxiety around clinical experiences because maybe they don't know what types of experiences count as clinical hours. Maybe they're concerned that the hours that they get won't be the right kind or won't really look good. Maybe they're worried they won't have enough. They don't know what enough is. Maybe just in general, they're feeling anxious, they're feeling overwhelmed. There's a lot of uncertainty about the clinical hour requirement. And that really doesn't have to be the case. This can really be a very strong part of your application that can bring a lot of confidence to who you are as a med school applicant. So, a little bit about me and how I know this. I'm Dr. Lori. I work very closely with Ray. He's one of our employees, one of our coaches, pre-med coaches, and he and I put this training together, put all of our experience together. We've worked with well over 150 pre-med students. That number actually is a little bit obsolete. We've worked with over close to 300 pre-med students. I have over 20 years of teaching experience as well. We support pre-med students from freshman year all the way up to med school acceptance. And so we've followed students through their entire journey of being a pre-med student. So we've personally designed all of our programs after years of proven results with pre-med students. So based on all that experience, there's a lot that we've come to know about clinical hours and clinical experience. First, what is it? So a clinical experience is loosely defined as any experience that is inside a clinical setting for healthcare purposes. So that means anything that is related to a clinical setting is a clinical experience. Now, you want to strive for direct patient interaction. That's going to be the most beneficial clinical hours. But even if you are not directly interacting with patients, that still counts as clinical experiences. Typically, you want over 100 hours, and even better if you can get over 150 hours. It does depend on where you're applying, what type of application, if it's DO or MD or nursing, PA, that will determine how many you need. But if you have over 100, 150, then you're going to be pretty solid on your number of clinical hours. You will need to be able to record them and provide verification for all of your experiences. That part's very important. So make sure as you're gaining your clinical experiences, you're logging your hours, you're logging the contact information of your supervisors. You are also keeping track of details about your experience. So that part's very, very important. Don't just write down, I worked as a scribe for 3 hours. Make sure you're writing down what that experience was like, who the supervisors are, their contact information, etc., because you will have to provide verification for that. And if you cannot provide that verification, you can't count it as clinical hours. So, why is it important? It, it lets medical schools know that you are serious about a career in healthcare because quite honestly, medicine's not for everyone. And a lot of students think they want to be a doctor, but they have a lot of like preconceived notions that are incorrect about what it's like to be in the healthcare field. So at the end of the day, working in healthcare is providing a service and it's customer service. So if you have experiences in clinical settings, that's going to help medical schools see that you have a lot more understanding of what it's like being inside those clinical settings. An excellent academic record is only half of the requirement for med school. So you want to also use experiences inside clinical settings to help yourself stand out. If you've seen some of my trainings, if you've been around with us for a little while, you hear me talk about building your narrative. That's how you're going to stand out. You want to build your narrative that starts to put you together as an actual person instead of just another application. And your clinical experiences can be used to support that narrative. And I'll dive into that a little bit more in a second. Also, once you get to med school, there's no trial period. You're essentially going to be working at hospitals, you're going to be shadowing instructors, you're going to be doing clinical rotations, surgical rounds as soon as you get in, right? A lot of times the rounds and rotations start in your third year, but there's not really a trial period to see if it's for you or not. Med school's expensive, it's a huge commitment, and these clinical hours can be a way for you to really confirm this is something you're passionate about and this is something that you do want to do before you make that huge leap, that huge commitment of beginning med school. So, let's talk about how you can use your clinical hours to your advantage to strengthen your application. So, depending on what the hours are, they're going to be weighed differently. Not all clinical hours are evenly weighted, evenly considered. First off, you want to make sure you are showing consistency. This is a big mistake that a lot of students make. They think I'm going to have a few hours here, a few hours here, a few hours there, and they have this charcuterie board, right? This smorgasbord of experiences that are unrelated and all over the place. And they think I'm going to show myself as a very well-rounded student. That's how I'm going to stand out because I have experiences everywhere. But what that actually says to a med school is you cannot be consistent. You cannot stay in one place for a period of time, kind of like somebody who can't hold a job down for more than 2 weeks, kind of thing, more than 2 months, kind of thing. It shows that you can't be consistent with something. And then it also just presents you as this completely bland applicant with no passion and no personality. And those two things, having no passion and not being able to stay consistent, those are like the last things you want to convey in your experiences. That's not exactly what you want your application to say about you, right? So instead, you want to show that you have commitment, that you can follow through with things, and you want to show that you have passions that you're going to pursue. Use your clinical experiences to do this. It is so much better to have a few different experiences that you do repeatedly, that you do continuously, consistently, than to have just a smattering of all different types of experiences that aren't even related. So you also want to think about what responsibilities you have during these experiences. Are your responsibilities related to patient interaction? Are your responsibilities related to confidential information? What are you in charge of? So make sure that as you're logging these experiences, you're thinking about that and you're taking note of that so you don't have to go back and try to remember it later. And then also think about how the role that you're doing in your clinical hours will impact your career in medicine. How does it relate to what you want to do in, again, in what you're passionate about? So you're going to use your experiences as a foundation for your med school application. You're going to use these experiences to create, here's this word again, a full narrative from start to finish. So your personal statement is a great place to show your personality, right? Everybody pretty much knows that already, but that's not the only place your passion is going to shine through. You want your passion to also weave into your clinical experiences. So if you are very, very, very passionate about pediatrics, for example, you want to be getting clinical experiences that are related to kids, that are related to pediatrics in some way, and be able to show how this is connected to things that you're passionate about. Again, very important that you save the information of the people that you meet through your clinical experiences. You're going to need their contact information to be able to verify the experience on your application. But also, this is a great source for letters of recommendations. You'll need, especially if you're doing MD school, you'll need letter of recommendations from MDs. And so the MDs that you meet through your clinical experiences, keep that in mind. Nurture those relationships. Send thank you emails, thank you notes, thank you letters. Then continue that contact, because that's going to be a really fantastic source for a letter of recommendation, because they will be able to vouch for working with you in a clinical setting. So, direct patient interaction. Again, not all clinical experiences have direct patient interaction, but you want to prioritize those that do. That includes, or basically what that means is just talking to patients in some capacity. You want to, maybe you're assisting patients, or there's post-treatment centers like physical therapy. Some examples of roles that are really common that involve direct patient interaction. Medical scribe is probably the most common. I would say like 80% of the students we work with at some point have been a medical scribe. That's a really common one, and that's a really good one. You could be a medical assistant, a medical transporter. Basically, you're just wheeling them around where they need to go. Medical orderly, EMT, technicians for different specialties. Phlebotomist is another one that's really common that we see a lot. A CNA. You can also do shadowing of doctors. That's a very common one that also is very, very positive. So biggest question we get, probably, I don't know, I say that a lot. I've said that about every question, but where do you start? How do I find these experiences? Most larger universities are going to offer some sort of course for a certification on like CPR, EMT, phlebotomy, etc. So some of these experiences, like if you want to be a CNA, obviously you need to be certified for that. Some of these experiences do require certification and extra training. So look, if you're at a larger university, look at your university to see what type of courses they offer. Or if you're not at a large university, but there's one in your town, look and see what types of offerings are available. There's also third-party licensings and certifications, things like CNA, medical technician, etc. That could get you some if you have those certifications, that can give you some opportunities. If you're in Arizona, if you're at U of A, here's an example of, or here's the link at U of A that is related to these certifications that I'm talking about. So probably one of the easiest way to get started is just contact your primary care physician. Generally, almost every PCP is going to be okay with you shadowing them for a day. Write them an email, give their office a call, just let them know, hey, I'm a pre-med student. I need to get some clinical hours. I would be very interested in shadowing you for a day. Is that something you'd be open to? And how can I go about doing that? Almost always, if they're your primary care physician, almost always the answer is going to be yes, because you already have that relationship there. You can also ask your PCP about other clinicians or surgeons, or again, depending on where your passion is, other doctors that would be open to you being able to shadow them. Doctors know other doctors. And so if you are not interested in any sort of general practice, but you have your PCP as general practice, ask them if they know people who are orthopedic doctors or pediatricians, or again, whatever specialty you're interested in. Doctors know doctors. So a lot of times they'll have referrals for you that they can suggest for you to be able to shadow. You can also ask your mentors, ask your advisors, go to people in your department, the physiology department, um, your biology department, go to your professors, go to your deans, go to your academic advisors, go to people that you're connected with in school and ask them for referrals as well. A lot of times they will, again, have people that they know, and referrals go a lot longer than just a cold email. But last but not least, you can send cold emails to doctors. These are not high yield. You're probably going to have to send like 100 emails and you might get one back. But that one that you get back will generally be a pretty good place to start. So you'll have to send a lot, but it is a good way to make connections with new doctors and to be able to talk about opportunities. If you are sending out cold emails, choose something, again, that fits your narrative. What are you passionate about? Where do you have the most experience? You can go to, if it's a medical school, go to that department website. Again, if you're at Arizona, here's a secret little hack. You can put the department name .medicine.arizona.edu instead of just searching the banner website. And a lot of medical schools have something along this line that you can, if you figure out how they format it, then it generally is going to be the same across departments. Look at faculty lists, look at research lists. Before you email them, read something about them so the email can be personalized. You don't want to just copy and paste the same email to every doctor. Nobody's going to read that. Because again, these doctors are getting a lot of different emails from students, probably in the hundreds. So you want to think about how your email can stand out. Look into their research, make yourself seem genuinely interested, because again, you should be emailing people that are lining up with where your passions are. So tell them why you're interested. Tell them what your passion is and how it aligns with what they're doing. Don't make it look like a generic email. Again, don't just copy and paste. But if they see that you're genuinely interested in what they're doing, doctors get excited about that. Professors get excited about that. So that's going to make you much more likely to hear back from them. So try to stand out in some type of way. So other places to look, these are for U of A. There's official job posting site for everybody at U of A. And there's an official job posting site for students at U of A. Most universities have a link like this. So whatever your local university is, go to their official job posting site. Go to their official posting site for student jobs and look and see what types of experiences are there. A lot of time, clinical setting type of experiences will be posted on there. You can also look on Indeed, Simply Hired, ZipRecruiter, etc. Local job listing websites sometimes will have some things listed as well. Be careful. Do not forget what your first priorities for med school are. So it is, yes, you do need clinical experiences. It is important to use those to strengthen your application. But if your GPA and MCAT score do not meet certain criteria, they will not even look at your clinical experiences. So don't think you can let your grades slip because you're getting experiences that are very strong. You always need to have good grades first and foremost. Do not put your time into clinical experiences that you should be using studying. GPA first, then MCAT score first. And then once you have those secure, then you can start spending your time getting your clinical experiences. Some students really need to spread that out. So if you need to put all your focus on keeping your grades up, do that and save your clinical experiences. Maybe you need to take a gap year so you can get some clinical experiences. Maybe you need to just do your clinical experiences during the summer. Keep that in mind. Keep in mind where your strengths are and how you do with balancing different different things that you have to do. Again, a balance of research and clinical experiences is also going to be best so that you become the best applicant. It's kind of been trending lately to where you almost research is required. So make sure that you don't only think about clinical experiences, you're also thinking about research opportunities as well. And again, don't just do a wide variety of experiences. Stick to a couple and do it consistently to be able to get the most hours for a long time at that certain position. All right, I hope that was helpful for you. We have a few different ways that if you have more questions or if you're interested in getting support, we have a few different ways that we work with students to provide support. We have pre-med advising sessions available. If that's something you're interested in, you can shoot me a DM or you can comment on this post if you have specific questions that you need to get answered. We also have an MCAT prep program. We recommend starting that summer, anywhere from the summer after your sophomore year, all the way up through senior year, depending on if you're taking gap years or not. But it helps you prepare for practice and do great on your MCAT exam. We also have a med school application support or med app program, which helps students tie together all aspects for their med school application to really present yourself as the best possible candidate. And in that case, we're there for you from primary applications all the way through acceptance. So if you're interested in any of those, you can email me. Here's my email here on the screen, or you can comment on this video and I'd be happy to talk to you a little bit more about that. Hope this was helpful for you, and I will hang around for another couple minutes if anybody has any questions in the comments.